The earlier we can start to make changes, typically the more effective those changes are. And the analogy that I'll give is that if you are someone who experiences migraine headaches, you might avoid taking medicine until it's at its worst. And most of our migraine medications are not going to work very well when the headache is at its absolute worst. It's much easier to treat early on in the headache and really prevent it from becoming a full-blown migraine. The same is true for obesity. If we wait until it's at its worst, when there are severe chronic health conditions associated with the obesity, it is much harder to reverse the course. When we're thinking about our GLP-1 medications like Ozempic, for example, if I'm treating somebody who has diabetes, they are likely to lose significantly less weight than if they do not have diabetes. I think of them as being a little bit further down the path. So if I have somebody who has obesity, and maybe they have insulin resistance or prediabetes, their response in terms of weight and metabolic health is actually going to be more robust than if I wait until they have diabetes and treat them with Ozempic. So the earlier we can intervene, the less harm we see to organs, the easier it is to have those interventions stick. And of course, because time only moves in one direction, if we are able to treat their obesity earlier, that's fewer years that people are experiencing whatever behavioral health components are going on. So if we intervene with their eating patterns, right, so that they eat healthily more years of their life, that is going to be a better outcome. If we have people moving their bodies for more years compared to waiting until obesity is a problem and arthritis is a problem, we're going to have better health in their musculoskeletal system, in their joints, their bones, their muscles. So earlier intervention significantly improves outcomes rather than waiting until obesity is very severe and or there's other chronic health conditions associated.